It's Professor Kristen, and I'm here today to show you a step-by-step insertion of a peripheral IV. So let's get started. Now let's set up our supplies. So I have my IV flush, I have my IV catheter. I'm going to go ahead and open it up. I have my IV kit. And in my kit, I have actually my tourniquet, gauze, tape, and my antiseptic that I will be using. I like to get everything out and prepared so that it makes it a very easy flow and insertion. Normally, you're by yourself when you do this. I have my gloves, I have an alcohol wipe, and I have my extension set that I want to go ahead and open at this time. And I'm going to go ahead and flush and prime that set. You'll see some water drip out, and that's perfect. The other thing I like to do is loop up because I'm by myself. I go ahead and uncap this and lay it back into the container that it came out of. That'll keep it clean and aseptic. Okay, first I'm going to wash my hands. And apply my gloves. Remembering this is an aseptic procedure. Then I'm going to want to go ahead and assess the arm or the venipuncture site, looking for any excess hair. If there is any, go ahead and cut it with scissors or clip it with clippers, but do not shave. There's nothing, this side is fine. So now I'm going to go ahead and apply my tourniquet. And then I have already identified the vein that I'm going to stick. So now I'm going to want to cleanse it with an aseptic solution. This is a chlorhexidine prep. Always make sure that you pop it. And then you're going to want to do a back and forth scrubbing motion on the vein that you want to stick in the area that you're going to insert your catheter in. Always let it dry. Do not blow, do not fan. While we're in the process of letting it dry, I'm going to go ahead and rearrange my field, getting it ready for the insertion. And I want to get everything close that'll be very easy for me to access. Now that my site is dry, I'm going to go ahead and pick up my catheter with my dominant hand. I'm right-handed. I'm going to take my non-dominant hand, pull the cap off of the catheter, straight off, and I'm ready to insert the catheter into the vein. I want to go ahead and take my non-dominant hand and hold below to stabilize the skin in the vein, so while I insert, I have a more stable environment. You always want to stick bevel up. I'm going to go ahead and take my hand down. And I like to put my hand against the patient because that will help me stabilize as I stick. As I go in bevel up at a 30-degree angle, I stick the vein. And as soon as I can see a flash of blood, so I'm going to go ahead and slowly insert the catheter into the vein with my finger against the stylet till the skin meets the hub. Once there, I'm going to take my non-dominant hand and release my tourniquet, and then I want to take my non-dominant finger and actually press above the insertion site so that I can prevent some of the retrograde bleeding that might take event when I actually go ahead and hit my safety to bring the stylet back and out. It is out, and then I want to immediately get my extension set and go into the catheter. I'm going to stabilize the hub and actually twist and connect my extension set to the catheter itself. Now, before I like to go any further, I like to pull back just slightly to see if I'm in the vein. If I get a blood back into the site, that's perfect. But if you don't worry. It doesn't mean that you're not in the vein. Then go ahead and flush the site with 2 to 3 milliliters of solution, looking to see if there's any infiltration, and there's not. Now it's time to secure the actual IV. I'm going to take the gauze that was in the kit and just clean up the blood around the site so that I don't have a wet area that can actually set up for an infectious site. I'm going to now take my Tegaderm. I peel it off. And this is good to sit as long as the patient doesn't move. I always like to say be very still while I apply this. I go over the site, making sure I am not covering where the extension is connected. Now that this is secure, I can release my hands and feel pretty comfortable. I'm going to go ahead and flush the rest of the saline flush in. I'm going to detach and get rid of, and I'm going to go ahead and clamp the site. Okay. Now, this Tegaderm, you want to peel around, making sure that it stays to the skin. And just so you know that if the Tegaderm does not want to stick, if you lay your hand, the heat from your body will help it to stick to the patient's skin. Now, you want to then secure it even more so that they don't lose the site that you just stuck. So what you need to do is use the tape that comes in the kit itself. Do not use hospital tape. Do not actually put tape across the site before you put the Tegaderm on. Evidence-based practice has proven that this creates an actual infectious site. I like to take the tape that comes out of the kit, I go up underneath it with a sticky side up, and then I call it a chevron where I go up with a U onto the Tegaderm. Then I take another piece of tape. I want to make sure this is going to stay. And I don't want to necessarily go across there because I want to always visualize my insertion site. But I want to go across the hub of the connector so that it will be connected. Then we want to go ahead and loop the IV site up. And stabilize that and connect it and make sure it's secure to the patient. Then once you're done, you want to make sure that you always date, time, and label. I like to use the one that comes in the kit. And once I've written on that, I will go ahead and put it on top out of the view of the actual site. So every time I assess the patient, I can see where I've inserted and what the site looks like. I hope this video helps you put in a peripheral IV. And just remember, the more you stick, the better you'll get. Thanks.